Welcome to the next generation technological solutions in healthcare. Our facilitator is Matthew Leotine. He's vice president at BLR Research, where he's a sought-after management consultant. He's also a professor at the University of Illinois at Chicago. Welcome, Matt.
Hi, Gene.
So this theme number 4, technology's role in reducing healthcare spending costs. What are we going to learn today?
Well, the purpose of this panel was to address some key issues. Of course, everybody's aware of the problems with healthcare, and the ultimate strategic goal in this country is to try to reduce healthcare spending. And so the panel looked at how technology could be used to help reduce healthcare spending, examining healthcare-related monetary processes that are ripe areas for improvement, looking at which technologies could most readily be used for improving these processes and how they could be used, and what kinds of technologies can be used and how they can enhance those processes. And also touching upon the stakeholders and how all this would benefit some of the key stakeholders or affect the key stakeholders in the healthcare space.
Now, we had a great panel. Tell us about these people.
Yeah, the panel really represented a great cross-section of interests in healthcare. We had people from the medical practice fields, but we also have managers, we had IT people. So it really provided a great balanced set of views in this whole area on this topic.
So the thing I really found interesting in your executive summary here, Matt, you were talking about this health tech not only builds revenue, but it also cut costs kind of at the same time. That sounds a little nirvana-ish, doesn't it?
Yeah, well, as we get into it, we found that not only is there opportunity to reduce costs, but also improve profitability. It could also provide opportunity for finding new types of services which could lead to profitability, not only for the service providers, but also the payers. And then also here we talked about the fact that technology can be used to help try to realize the whole concept of personalization in the healthcare space. We talked about also some of the challenges, much of which is attributed not only to technology, but also to collaboration. It requires collaboration across many of the diverse players in the healthcare arena. And much of this is centered upon data and information, trying to synchronize and standardize data between all the players in the process.
Great. Let's get into key point number 1 then, which I'm really intrigued with. This is using technology to increase revenue, which I think is fascinating. Tell us about this.
Yeah, well, the idea here was to try to look at the overall experience from the patient point of view and try to provide a holistic approach to optimizing revenue cycle and those processes that manage the entire revenue cycle. So that means taking the front end and the back end functions, try to meld them together so that you can have more faster, more accurate reimbursement and processing of payments, and trying to shift some of the back-end functions to the front so that, for example, service providers and patients can view the account status before they even try to get services, and the service providers could also anticipate payment issues early on. Mm-hmm. Also using technology like automation to identify documentation gaps and errors in the point of care. That could also pinpoint health risks that are underdocumented, which results in insufficient payment, or it could also identify risks that are overstated, and that could then lead to costly audits and fines for overcharging. So the idea here ultimately is to reduce the risk of the patient being able to cover those out-of-pocket expenses throughout the whole process.
And key point number 2, you talk about something interesting, which is the personalization of the payment method. So that's curious. Tell us about this.
Yeah, well, the idea here is if patients could have the ability to look at where they are in terms of their spending and health savings accounts, that could help them manage their own ability to pay and their experience through the healthcare process. So here we looked at technologies like artificial intelligence and visualizations to provide engagement tools so patients can help develop their own personalized approach, as well as work with service providers and payers to personalize the approach even more. So ultimately, this could down the road reduce the inefficiencies in the transaction processes that are involved here.
Makes sense. Now, key point number 3, what we're really talking about here, this is the big challenge, right? How do we get technology, or how do we use technology to get everyone to collaborate and get us all on the same thing, right?
Yeah, well, the key takeaway here is the complexity. As we all know, healthcare is a very, very complex process, not only in the delivery of services, but also in the payment of those services as well. If there's any way to reduce the complexity through maybe coming up with standardized ways of handling data to improve the quality of data and also expand data access to more of the parties that are involved so that they all have a common view, a common source of truth, so to speak, then that could eliminate a lot of problems. It also requires the ability for some of the players to partner with each other, to come up with ways of doing this, maybe credit card companies and banks partnering with service providers. Ultimately, out of this discussion, we found out that financial institutions are key players that can add value to the outcomes of the patient's medical treatment.
So tell us about these top 3 experts that contributed on your panel.
Yes, these 3 experts represented both the medical field as well as the technology and managerial fields, and so they provided some great input to this panel. So we really appreciate their participation.
So I'd like to know where we're going then in theme number 5, because it kind of sounds like you're setting us up for the next chapter here. So what's next?
Well, in the next theme, what we took a little bit deeper look at data science and data analytic methods to see how they could solve some of these problems using some new methods and models that could be used to try to address some of the problems that we just talked about. So we'll talk a little bit more about that when we get to the next theme.
Great. Always a pleasure to talk to you. I look forward to our next conversation. That's Dr. Matthew Liety. He's Vice President at BLR Research, where he's a sought-after management consultant. He's also a professor at the University of Illinois at Chicago. And Matt, we will talk again.
Thank you, Gene.